Favorite number crunching doctors, Dr. Peter Lombard, onto the show. Good morning, Doc.
Good morning, Chris. How you guys doing?
We're doing pretty good. Let's just get right to it. I know that you've been crunching the numbers, and I've been following your Facebook. So, and just give us your latest take on the trends and the trajectories of the COVID-19 test results.
Yeah, well, I think if you look at these most recent pauses that we've had, at least in the past week, and the most important information to know is where are they coming from, and we don't know that. It's not being shared with us. So I don't know. From a just an anxiety perspective, it'd be really nice to say, hey, these are people that have had contact with positives. They're they're healthcare workers, or they're a family member. They were taking care of somebody. It would just kind of make us a little more comfortable than say, hey, this was somebody who walked off the street and they have no idea where they got it. That would be a little bit more concerning, because then public health is having to go out there and do a lot more tracing. So, but they're still just trickling in, and when they do this testing up in the community, if they get zero cases, that really would help to show that we're not really spreading it out there in the community anymore. And I think it's possible, but it's probably going to be very unlikely that they're going to be able to find a whole lot of cases out there.
What do you think about the balancing the transparency in terms of what kind of information we're getting about who they're testing, and taking that and making accurate, analysis of the numbers?
Well, I try to put myself in their shoes, and I know, the governor, the state surgeon office, they've got a lot of different priorities, and it's easy to put the hand up and say, oh, let's just not give that information out. They don't have to think about it anymore. They just move on to the next thing. But it takes time and thought to think about each data point and say, how important is this? I think they lose sight of what it feels like to be in our position when we don't have the information. Everything's an unknown. We're all starving for information. It's like the only thing that's going to make us feel more comfortable about what's going on. And because they have access to everything that's out there that can be known, they know it, or they can ask somebody, they can go find it for them. And I think it's easy to lose sight of what it feels like to be in a position of the public that doesn't have access to that information, and you're left to speculate and guess. So I do wish that they would spend more thoughtful time thinking about what they could release in a way that's not going to be harmful to whatever their overall efforts are. I haven't seen a whole lot of that, and in fact, the times that they put the hand up, ends up biting them in the butt a little bit later sometimes.
Have you had a chance to take a look at Public Health's website and their new dashboard?
I did the first day, and I was really excited to see it, and then I haven't gone back to it, to be quite honest. The data is kind of boring right now, I think. If the numbers are coming in at, one case here, one case there, I think that's to be expected. And again, if we knew more about those cases, you might want to pay more attention to it. Or if we start seeing a cluster show, then you might want us to start paying more attention to, okay, where are these cases?
Right.
How many are there? Are we seeing a trend here where we're going to start to have another little ripple? I don't know that we're going to have a wave, but if there are ripples that come, I think if public health does their job, they should be able to suppress those.
Mm-hmm.
Yeah, I agree. I think that when we're on a week now of really, really low numbers, and I'm just curious about, because I think they're still on that limited, or they were still on that priority limited testing group. So when we get 30 people, no positives, I'm curious. You're right. Who are they testing? Are these people who came into contact with people who are positive? Are they PUIs or what? Because I think it's very relevant. They should come out and say, hey, we tested a bunch of people who came into contact with somebody. We tested their family or whatever, and that was. But you're right.
Right.
And I think what you said about them forgetting what it's like to be us. You could take that and apply it to the COVID-19 test result numbers. You could take that and apply it to people who are struggling out here, waiting for any type of local aid to bridge them. You could kind of apply it across the board, which isn't a good statement.
Yeah, we're grasping for any piece of information that might be useful to us, and we don't have a whole lot more to do besides pay attention to what's going on out there. And then the perception is that they're not being as fully transparent or giving us as much information, and that's a perception, and they can't dictate the perception. The perception is what we feel, and that's what people feel. perception is reality. So I do wish they would spend more time on that thoughtfully.
Well, what would you like to know, Doc? What would you like to know?
Well, simple thing, just it's something I ask about almost every day is, well, just give us a little information about each of the new positive cases that come out, if you can. And if you can't, then just say you can't, and maybe why you can't, and with privacy reasons or HIPAA or ongoing tracing, it would jeopardize, something. I think we would all understand that more than just throw a number out there and then not say anything, or if there's some strange issue with the number of test results, to qualify that with why. Is it the reagent? Is it the swabs? Is it they just didn't have that many tests? I think it would just make us more comfortable with that. Now that we're past the peak, the first surge, everybody's a little less concerned, and I think there's less that I want to know. Before it was like clusters. Where are they? Why aren't you telling us which clinics are involved? This and that. So at this point, I'm not as and again, because we've been successful. Don't take away the fact that we've been successful here in Guam. Because we've been successful, it's sort of hard to sit back and criticize what they've done to this point. And one of the biggest things that I think that we need to recognize is that they acted quickly enough to bring us to this point. I've talked about on my post maybe not giving ourselves too much credit for being successful compared to other places, because we are an island, and I do think our sense of community here is probably better than a lot of other places, and maybe people were more compliant with the stay-at-home orders than other places, and because the stay-at-home orders, the closing the schools, the face mask, that same sort of policies are in play everywhere. But we seem to have done a lot better. Is it simply because of our community nature and the fact that we're an island, we can close the borders? And I think if you look at other island nations, you kind of see they're not doing so bad. So maybe it wasn't any heroics on our part in general, other than making sure we start right away rather than letting it get out of hand. That was definitely a big win. But it's something to consider.
I think also. Go ahead.
Oh no, I just wanted to say there was something you posted on your Facebook page. This topic should garner more media attention in the coming days. Even if you account for COVID-related deaths, more people are dying than normal. Is this unintended fallout of the lockdown? People so scared to see their doctors, they are dying from the usual suspects.
Yeah, we don't know. This is really interesting. I posted a link to a study in I think Santa Clara, but there's another study that came out in New York City. Same thing, New York City, where they're having tons of people die, and they look at the total number of deaths and they subtract out the number that have died of COVID, and there's still more people dying of non-COVID related stuff than in a normal year for over the same time period. So there's something going on where the fact that there's COVID in the world is causing more people to die for whatever reason, and so it is very interesting, and I don't know what it's going to mean exactly, and it may have nothing to do with the fact that people are not getting their health care, but maybe that has something to do with it. And if we went about our business more normal, and people did get their regular, they went to the PCP, they got their refills, they got their blood tests, is that having an effect on this sort of missing number of deaths out there? I don't know, total speculation, but it's interesting, and I think people will start talking about it more.
Well, I think and that's part of why we're seeing some of the doctors like Dr. Hoa, Dr. Cabrera, they're talking about COVID, but there's also this side conversation about hey, people with these chronic diseases, you've been sheltering for over a month.
Yeah.
Make sure you refill your meds, make sure you call your doctor, make sure you check in, because they're worried that we could see a wave of hospitalizations that has nothing to do with COVID-19.
Yeah, exactly. And in my field, I've got diabetics that need injections or lasers, and if they're home because they're afraid to come into the clinic, and they could potentially lose vision because they don't get their routine care. So I'm definitely seeing it on my side too. We're trying to get their urgent patients into their regular appointments, but some of them are just declining, and I got to understand that too. They're afraid.
Yeah.
What do you make of the community testing? Again, you think this is something that I know you said you're not anticipating us getting a lot of positives. So why are you saying that?
Well, I think it's if we do, it's going to be very, very curious. I think that there are people out there that get the disease that are long incubators. It could be 2 weeks before they, before they seroconvert, before they would even be infected. So if you get 2 people in a row that are long incubators and they're asymptomatic, that's a month's time where they could have transmitted within a family. Okay, even one more person further, you've got some big families out there in households. That's 4 to 6 weeks of transmission, and so those people might be out there, and at some point, one person may start infecting people who do get sick, and that can be the start of a cluster. So if they do find somebody like that, it'll be very interesting to try to trace to see where that came from. I think it's certainly possible. I think if you've been following, I just threw out sort of a rough estimate of about 4,000 people in Guam who might have the disease in total, and most of those obviously being asymptomatic or people with low symptoms, and that's based on some early prevalence data that's coming out. New York, by the way, they're estimating maybe 14 to 15% of New York City might have it because they're one of the hardest hit cities. But if you take about somewhere between 2 and 3% for Guam, we're talking 4,000 people. So if 4,000 people have been affected to this point, right? Most of them are probably already also recovered or recovering by this point. If we've done a good job with social isolation, you're starving the virus out, right? The idea that we're going to be able to go out into the community and find some people now, I think it's not very likely, but it could happen. If we are continuing to have community spread from asymptomatic to asymptomatic person, at some point, somebody's going to have to come to the hospital because we know that some people are just going to get sick enough. And if we're not seeing those admissions to the hospital with people with COVID, then I just don't think that there's a whole lot of community spread going on among asymptomatic people.
What are your thoughts? There's people who have said that COVID has been on Guam a lot longer than March. That it's actually been around since say November of last year.
January.
Yeah. Yeah, well, it may be January. I think there was the coroner report from California showed that they had a death that much earlier than they had their first documented case out there. So it's possible, and I think probably likely that we had it here, certainly in February. And anecdotally, there's people who say in the hospital they had some really sick patients, and they think back and they thought that person probably had COVID. So I think it's very likely that we had some. Now, December would be a bit more of a stretch. There was a big article about, California's got herd immunity because the virus was in their community in the fall and the winter last year. That's sort of been debunked by good science. They look at the when they collect these samples, they also submit them for genetic analysis, and so you can actually look at the genetic analysis and see how the virus mutates over time. And by doing that, you can track where it came from. And because of the types of strains that they saw in the California data, they know it came from locations that had the virus before them. Okay, so when you look at and see the mutations that are happening on a virus, it kind of is a nice timeline. Gives you a timeline of when and where the virus was. And a fantastic website, if you want to go take a look at this, is nextstrain.gov.
What about that, applying that kind of same thing, that same idea to Guam, where, we've been trying to ask about these deaths that were classified as PUIs. We know that some bodies have been tested. They turned out negative. But what about that conversation? Do you think we're ever going to get to that point where we're going to exhume bodies, we're going to go back and look at, have we had any other deaths? Or do you think that maybe the political will to do that probably isn't here if we're trying to reopen the island?
Probably not, and to be honest, I don't think it's going to make a big difference. It's a nice talking point and something that I think it's a good thing to talk about. And I think most people would probably say, yeah, we probably did have some. I think it'd be silly to think otherwise,
right?
Especially in light of the recent finding in California. But I don't think we're going to gain a whole lot from that. Oh, yep, it's true, we did. And okay, now what? So I think. From my perspective, it's kind of assumed that we did have a few. Don't know how widespread it was, but again, if it was more widespread, I think it would have been more of an issue in the community.
Okay, all right. Well, thank you so much, Dr. Lombard, for all of your input today. Any final comments?
Well, thank you guys. I don't know how you do this every day. It's kind of an emotional topic, and you guys really get into it. So I really want to want to thank you for. I don't know how you wake up every morning and have the courage to go out there and do what you do. So
well, there's a lot more people who got a lot more courage than us. But it's funny that I'm going back to what you talk about. People kind of locked in and maybe dealing with things they don't really know they're dealing with. Like, I mean, we're stressed, but I didn't even know I was stressed till I started running again last week. And after I did that run, I was like, wow, I needed that. Holy whoa.
Yeah.
So I mean, I think there's a lot of stress that's on us that maybe we don't know because people are just plodding through these days, and there's just all these outside factors of are we going to get COVID? How are people going to eat? Anyway.
Yeah.
It's a little early to go on about that.
I know.
As I got 3 more hours. Thank you, Doc.
Thank you.
Thanks for having me.
Be safe. Wash your hands.
Bye-bye.
Okay. 6:45. Let's keep it with the doctors and go over to Dr. Tom Shea. Good morning, Dr. Shea.
Morning, Chris.
Half a day.
So first, we're gonna get Catherine from the chamber on, but I just wanted to first kind of start with you and this. There's a message going around on WhatsApp. We've been